Peptic ulcer disease is the erosion of the mucosal layer of GI tract, which is normally related with the acute inflammation. Even though ulcers may occur anywhere along the alimentary canal, but most common site is duodenum. Stomach ulcers can be on the either side of the stomach. Ulcerations in the lower small intestine is known as Crohn's disease, and ulceration in the large intestine is known as ulcerative colitis. These diseases are known as inflammatory bowel disease. There can be many causative factors for the peptic ulcer, development of the peptic ulcers, such as H. pylori infection, non-steroidal anti-inflammatory drugs such as naproxen, diclofenac, or ASA, family history, glucocorticoids, psychological stress, hypersecretion of the gastric acid, or cigarette smoking. Location of the pain. In gastric ulcer and in the duodenal ulcer, pain occurs in the mid-epigastric region. In the gastric ulcers, client experiences sharp and groaning pain, while in the duodenal ulcers, client experience burning pain. Relationship with the meals. Gastric ulcers, the pain increases with the food ingestion, and with the duodenal ulcers, pain relieves with the ingestion of the meals. Bleeding. In the gastric ulcers, most common bleeding is hematemesis, which is blood vomiting, and then in the duodenal ulcers, bleeding is through the stools, which is melena. Most commonly used drugs for the treatment of the peptic ulcer diseases: H2 receptor antagonists, proton pump inhibitors, antacids, and antibiotics. H2 receptor antagonists mechanism of action. H2 receptor antagonists, they block the acid secretion by the stomach and are most commonly used to treat the peptic ulcers. And commonly used peptic ulcers are the ends with the dine, such as cimetidine. Next is famotidine, ranitidine, and then nizatidine. Nursing considerations. Lifestyle changes. Before we go ahead with any pharmacological therapy, we advise our clients to make lifestyle changes if possible. We would advise the client to avoid cigarette smoking, avoid alcohol. We also encourage the client to sleep with the head elevation at least 30 degrees. And then we also advise the client to reduce stress. Diet changes. Advise the client to avoid caffeine-containing substances, as caffeine irritates the gastric mucosa and it increases the acid. We would encourage the client to include foods with good bacteria into the diet, such as yogurt. And drug interactions. Ranitidine may reduce the absorption of antifungal drugs, such as ketoconazole or itraconazole. So in this case, whenever we are starting a patient on any antifungal drug, when the patient is taking ranitidine, we have to be careful about this interaction. Side effects. Most common side effects of H2 receptor antagonists are headache, confusion, dizziness, or drowsiness. And H2 receptor antagonists may cause vitamin B12 deficiency. So how this happens? Because H2 receptor blockers, they decrease the secretion of hydrochloric acid in the stomach, and gastric secretion is necessary for the releasing of vitamin B12 from the food. By affecting the stomach acidity, H2 receptors affect the absorption of the vitamin B12. So we must educate the clients the importance of including vitamin B12 into the diet, such as red meat, fish, eggs, or poultry. Pregnancy category. H2 receptor antagonists are pregnancy category B. That means safety during pregnancy and lactation for these class of drugs has not been established yet. So these are all nursing interventions or considerations we'll keep in mind, such as lifestyle, diet, drugs, interactions, side effects, and category pregnancy. while dealing with the peptic ulcer disease and using the H2 receptor antagonists. That's all about peptic ulcer disease and the role of H2 receptor antagonists. In the following lectures, we will be discussing the remaining pharmacology options for the peptic ulcer disease. Thank you.